My name is Derek Henderson. I live in Toronto, Ontario, Canada. I'm a CTEPH patient. I've had CTEPH since 2013. I'm an avid biker. I bike a lot when the weather's better. What ended up happening was that I just was losing my breath. My bike routes times were going down. Eventually, I was diagnosed with pneumonia twice. A couple of years passed after I was diagnosed with pneumonia, and then it started happening again. I went back and they did some more tests. They found it wasn't pneumonia this time. And it just kept getting worse and worse and worse. And eventually it got to the point where I couldn't walk the length of my house, which is about 100 feet. So that's when I went to the hospital and I was diagnosed with blood clots. And then eventually I became diagnosed with CTEPH. Initially, I was just in the hospital with blood thinners. And then I got out, and then they gradually cleared up the initial problem. And then in Toronto, I was referred to Toronto General Pulmonary Hypertension Clinic and eventually just run some tests. At the time, the policy in Toronto had changed from the PTE surgery from going to be curative or done when there was an emergent problem to being more preventative. So I was one of the first patients that the policy affected. So I was done before it was needed to be done. In other words, they did it to prevent future problems. So I was lucky in that regard. What ended up happening with me is that it went from about 7 months between the time I was diagnosed, the time I had PTE surgery. So it was fairly fast. For me, part of the thing was that when you're going through PTE surgery, you have to do a bunch of tests to make sure that you're doing okay for it, that you can live through it, in effect. There had been a bit of a gap between my initial review at the clinic and then the actual intake towards the surgery. So I got a call that I was scheduled for a bunch of tests, which was, routine, normal stuff. Then I got an email saying that we'd like to come to talk to you about the date of your scheduled surgery. The email was on a Monday. I had a right heart catheter test to measure your pressures in your right heart on a Wednesday and on the Tuesday. So I got the email on a Monday. On a Tuesday, my wife and I went in to talk to the surgeon about the surgery. And at the time, we didn't even know we were for sure scheduled for PT surgery at all. And I found out on Tuesday that I was going in the following Monday for surgery. And it ended up that I really did not have a lot of time to get ready for it, nor did my wife or my family members have any warning for it. It was a bit of a surprise, but in some ways that might have been a bit better for me because I didn't have time to think about it. I didn't really realize how serious the problem was until afterwards. So in other words, we had the surgery and, for those of you who don't know, it's open heart surgery. You're put into hypothermia. They turn off the heart lung machine. They dissect some of the lungs and some material out of your lungs. So it's pretty dramatic surgery. I didn't really have time to look into it that much before we had it. And I didn't really realize how sick and how serious the problem was until afterwards. And I think that might have been a bit of a blessing in disguise because I wasn't quite as freaked out as I would have been. And what I found later on was that I had surgery in August, and then in December, the clots came back a bit just because my blood thinner medication wasn't working that well. And then I had time to sort of think and sink in a bit about what had happened, what the problem was, how bad the surgery was, how serious the problem was. It was sort of a delayed reaction to me just because I was focused on recovering from the surgery and dealing with all the side effects of I had lost some jobs, I had to get back, my employment had to come back, all that sort of stuff. And then I finally had some time to sort of realize, wow, I was really, really sick. It's quite a bit of a change, especially for someone like me who's really never been that sick. There was a lot of appointments. You have to understand too that I was not that sick. I didn't feel sick before I went into surgery. I live about 5 miles from the hospital. I could have easily biked or walked to the hospital before surgery. So to come back out from that surgery and really not be able to walk around my own house, and I got better fairly quick, but still to come back out from that aspect of it was a bit of a shock. Took a bit of getting used to just to, I had to measure my trips up and down stairs. And also people would tell me that, oh, you don't really look sick. I was trying to cross some streets and people would honk their cars at me saying I wasn't walking fast enough. I was just being lazy. To go from being able to bike 15 miles to being able to barely walk around your house was quite a bit of a shock for the surgery. What I would sort of tell people is just to, first of all, to reach out to someone that's had it before. Your program and others that are around now are a lot better to give some people some advice as to what you can expect from the surgery. I mean, a lot of people don't tell you to hug your pillow after your surgery, which is a great thing for heart patients. To try to stay active, just try to start walking as much as you can. and to get involved with your physician and to just to learn about what's going to happen, what the plan is, and actually even like when you're recovering from this surgery, to have a plan of something to do to keep yourself occupied. That's the big thing. And also to let your friends know what's going on, what it's like to have the surgery, and if you need help or if your caregiver needs help, to let them know what's going on. Because with pulmonary hypertension, there's no fear involved when you hear the diagnosis. With cancer, there is. So if you hear somebody has cancer, oh, there's a fear involved. With pulmonary hypertension, there isn't. And it can be just as bad, it can be just as traumatic, and it can be just as deadly. So you sort of have to do some education to your family and friends as to what's going on with it. For me, it took a few years to completely recover after the surgery. I think part of it is I was a little reluctant to push myself physically. Certainly now, you probably couldn't tell that I ever had that surgery. I become a lifelong patient of blood thinners. That's one thing for me. My life is pretty well back to normal, but I don't take things for granted. Obviously we're recording this in a COVID world, so I'm not able to do as much traveling as I normally would, but I travel a fair bit during non-COVID times, but I also don't take things for granted anymore either. And I pay attention to if I'm sick of it. I get it seen quicker than I used to, which is probably one of the bigger things that have changed for me. Otherwise, I've been lucky. I've been able to recover back to pretty well my normal lifestyle that I had before. The biggest thing, though, that I would say is that there's a misconception for people that Canadian healthcare, everything's paid for. I spend now $1,300 a month on drugs. My employer pays a fair bit of it because I have a good drug plan, but that's a lifelong payment for me unless my drug therapy's changed. That's $1,300 a month. That's a fair bit of money that you have to spend that someone else doesn't. So it's something that I never would have thought of before having this problem. I'm Derek Henderson, and I'm aware that I'm rare.